Good evening.
All your favorite products under one roof in Bahrain from our 14 branches at 27-year-old Megamart and Macromart. Bakery, fresh meat and fish, fruits and vegetables, sweets and snacks, ready-to-eat foods, dairy products, grocery or consumer goods. To have a wonderful shopping experience, please visit your nearest Megamart Macromart branch. Megamart and Macromart, full of goodness.
Good evening, dear friends. Welcome to yet another episode of BMC Global Live, Hilal Health World, nothing but lifestyle. This talk show is exclusively with the expert doctors of Hilal hospitals and medical centers. Orthodontic treatment is a specialized dental treatment which corrects the misaligned teeth, and the main device we use for orthodontic treatment is the braces. To talk authentically about this treatment, we have the orthodontist from Hilal Hospital, Manama, Dr. Savan Unni. So, doctor, welcome to the show.
Thank you so much for having me in the session, miss.
Thank you for joining us today. So, doctor, you are an orthodontist.
Yes.
So, what is the role of orthodontist in dentistry?
Yes, miss. So, I'm a dentist specialist in treating patients with irregular teeth and jaws. I help them in achieving a stable, functional and an aesthetic bite, and I helped in doing so with the help of various orthodontic treatment approaches.
So, doctor, what are the common types of misalignment found in people?
Yes, miss. So, when it comes to our daily practice, since we treat multi-ethnic groups, we come across various types of misalignment and malocclusions. So, the most common ones that we see are something called as spacing or gaps between the teeth, which usually it's attributed to something called as high frenal attachment. So frenum is a tissue that connects the lips to the gums. So whenever it's a high frenal attachment, it tends to give a passive pull that leads to the teeth drifting apart, the front teeth especially. The second most common scenario that we see is something called as foully placed teeth or proclined teeth. This usually happens when there is a mismatch between the jaws or there is a faulty position of the teeth. And the third scenario will be severe crowded teeth. This occurs whenever there is a lot of jaw constriction. This can lead to something called cross bites as well. So these are the most common scenarios that we see, but all can be addressed very well with orthodontic treatment approaches.
So doctor, what are the treatment options?
So when it comes to treatment options for braces, I can broadly classify them into conventional braces and advanced braces. So when it comes to conventional braces, those are standard braces which are available in metal or ceramic, the tooth color options. So in this, what we do is we'll place attachments onto the tooth surface and wires will be fixed using the help of elastics. The elastics can be of tooth color or transparent as per the patient preferences, and all the movements will be brought about. So in the conventional braces, since heavy elastics are used, the time duration usually will be slightly longer, and there is mostly or always a need for teeth removal. Multiple extractions may be required, and heavy elastics might lead to a lot of discomfort also to the patients. And because of these drawbacks, more advancements occurred and new advanced braces called self-ligation braces were developed. So in self-ligation braces, there is a locking mechanisms. The locks will only hold on to the wire, so the movements are much more smoother and comfortable. And even when it comes to the need for teeth removal, either we can minimize it or eliminate it altogether. And the most advanced state-of-the-art system that we have when it comes to orthodontic alignment is something called as aligners. In aligners, what we do is when the patient comes to us, we generate a 3D scan of the teeth with the help of intraoral scanners. Using some software simulations, we'll pre-program all the movements that is required to achieve the desired outcome, and I'll custom make removable transparent trays for the patient. So these trays can be worn by the patient at the comfort of their home, and within the desired time frame, the outcome can be achieved. And these are all the options when it comes to fixed orthodontic treatment approaches. There are a lot of other treatment modalities as well, depending on how severe the case may be.
So what is the ideal age for this braces treatment?
Ideal age for braces treatment, miss, I would not say that's a hard and fast age for braces treatment, because I've had patients who are as young as 7 to 9 years old and even as old as 60 or 60 plus as well. So what we do is we usually advise a set of radiographs to check how the bone support is and overall periodontium support. Periodontium is the supporting structures around the tooth, the gums, gingiva, so on. So as long as the gums are all healthy, periodontium is healthy, we can go ahead for the braces treatment. And there are certain cases in which there are some malocclusion that is developing. If it's caught at the very young stage, let's say developing class 3, that's a developing jaw discrepancy where one jaw growth exceeds the other, or else uneven bite called as cross bite. At the starting stage, if you're able to diagnose it, it will be very easy to correct, and it will require very minimal intervention. It will not require extensive treatments which involves teeth removal, or later on, if left untreated, surgical approaches will not be required at all. And even when it comes to adult orthodontics, what happens is you have had scenarios in which when I'm treating the patient's bystander, the parents might be asking me, doctor, like I wanted to have my treatment done, but I feel I'm too old for the treatment and I'm having multiple fillings and caps, and I have few missing teeth also, but I don't know how to go about with the treatment now. So to them, that I say is that like there is no need to worry. We can plan on something called adjunctive treatments, in which a comprehensive treatment approach can be done, which involves periodontal treatment to improve overall the gum health, then plan on some prosthetic rehabilitation so that the missing teeth issues can be addressed, and side by side orthodontic treatments can also be undertaken so that we can give a functional, stable and aesthetic occlusion, the bite. And lastly, it's always best to diagnose and treat at the earliest. So I would recommend a frequent checkup, 6 months once or so.
your favorite products under one roof in Bahrain from our 14 branches at 27-year-old Megamart and Macromart. Bakery, fresh meat and fish, fruits and vegetables, sweets and snacks, ready-to-eat foods, dairy products, grocery or consumer goods. To have a wonderful shopping experience, please visit your nearest Megamart Macromart branch. Megamart and Macromart, full of goodness.
Another common query from our viewers is the treatment painful?
So not necessary that orthodontic treatments are painful, but I will not say it's pain-free either, because end of the day this is an appliance that we are fixing onto the mouth, the oral cavity. So there's always a getting used to phase. So at the starting stage it's natural for patients to develop a bit of discomfort while talking. Some ulceration issues might be there, but slowly that tends to subside off. And as the patients review, monthly reviews keep on advancing, they get more and more comfortable. Only the starting stage, when the teeth are very severely irregular or so, patients may tend to have a lot of discomfort, but the more and more the alignment keeps occurring, they'll get more and more comfortable. I've had scenarios in which patients might come back to me and say that, doctor, I'm not feeling that tightness or pain like how I was feeling like before. So these are all situations in which their body slowly starts adapting to the orthodontic forces that we give, but it's completely normal, not to worry at all. And when it comes to the type of braces that is used also, the pain factor might come into play, because whenever the conventional braces are used, where we use a lot of heavy elastics, patients might tend to have a lot more of discomfort than the self-ligations, the advanced braces. Because in advanced braces, since locking mechanisms are there, they tend to give very light, more comfortable forces. And the most advanced option of aligners gives precision movements, making the movements even more comfortable, like that.
So doctor, another common doubt is there a need to remove the teeth during this braces treatment?
Yes, miss. So now we are moving more towards an evidence-based practice. So it has come to our understanding that each patient or individual responds to braces treatment on a different manner. So we all earlier the school of thought was we may have to extract the teeth, remove the teeth right before starting the braces treatment. But now that's not the concept. We will fix the braces. We'll see how the patient responds to treatment, and after a couple of months, we'll take a call whether to go ahead for the teeth removal or not. And the aesthetic perception differs from patient to patient as well. See, me being an orthodontist, I would want to give the perfect finish or outcome for the patient. But patients, as long as their aesthetic requirements are met, we can plan on earlier finishing of the case as well without teeth removal, as long as the bite is stable as well. Even when it comes to the need for teeth removal, depending on the type of braces that you're opting for. Let's say if you're opting for the conventional braces category, you may require multiple teeth removal. But if you go for the more advanced system, there are technique sensitive procedures like distalization, interproximal reduction, and arch expansion, with which we can gain spaces so that we can avoid the need for teeth removal. So multiple options are there, in which we can undergo treatment even without teeth removal.
Some people have the conception that they have to remove the teeth. That's why they don't go for this braces treatment.
Yes.
So doctor, what is the duration of the treatment? Can you explain for us?
Yes, ma'am. So on an average, treatment duration might take somewhere between a year to year and a half, up to 2 years or so. And in certain scenarios where we plan phase 1, phase 2 treatments, in those scenarios, treatment time might be slightly longer. So in phase 1, phase 2 treatment, what happens is in phase 1, we do a lot of functional growth, functional bone growth or functional therapy, which might usually tends to last for one and a half year or so, after which we will plan with fixed braces that can again last for one and a half year. So overall treatment duration might extend to 3 years or so. Apart from these sort of scenarios, usually it takes somewhere between 1.5 year or so, 1.5 year roughly.
Okay, you mentioned about the duration of braces treatment as 1.5 years. So if the patient has to travel, for example, for studies, what will happen?
Okay, miss. So at the time of consultation itself, I do ask the patients whether they have any plans to travel anytime in the future, because braces treatment invariably might take at least a couple of months to a year or so. So what happens is, for those patients, I would recommend something called self-ligation braces, which does not require monthly reviews, even 2 months once or 3 months once if they visit, it's well and good. And for patients who might be out of the country for longer time, I would recommend aligner treatment, in which we can pre-plan the movements that is required for the patient, and I'll custom make the trays. The patients can wear the trays at the comfort of their home. But after a couple of months, when they're back, they have to visit so that I can ensure the treatment progress is going as per plan, and from further on we can take the treatment ahead. And in conventional braces also, if patients are traveling, if they inform us prior, we can lock the appliance so that no unwanted movements will take place. So even traveling, I don't think it will be an issue, miss. We can address that at the time of need.
And is there any diet restriction during the braces treatment?
Yes, miss. So I do have patients who are like foodies. So what happens is, like, there will be diet restrictions, because if you bite something too hard or so, the attachments, that's the braces attachments, might tend to break. If it breaks, whatever movement we have achieved for that tooth or that set of teeth will tend to relapse a bit. So it may require some further time for the correction to occur again. Apart from that, like, if you have some sticky food items also, it will be difficult for you to clean and maintain the oral hygiene, and this may lead to some decay issues. If you're very particular, you do not want to have any diet restrictions at all, the treatment that I would recommend you is aligners, because in aligners you can remove these transparent trays, have whatever food that you crave for. After having food, make sure you wash thoroughly and place the aligners back on.
Okay, can you now explain about the retainers that is used during this treatment?
Yes, miss. Yeah. So retainers are as important as your treatment. Once your orthodontic treatment gets completed, towards the end, we do not want any changes to happen. So retainers, as the name suggests, either fixed or removable retainers will be advising. It will tend to hold the corrected teeth portion in its place. The reason why we give retainers is that muscle forces we cannot control. When we chew food, a lot of heavy forces will be there. Your tongue is a muscle, keep on giving some pushing force against the teeth. Even the cheeks act like a muscle blanket. So that's a natural tendency for the teeth to drift apart a bit. To minimize this, we advise retainers.
And finally, doctor, is the treatment expensive?
Yes. So, miss, a smile is a valuable asset that's going to last you for a lifetime. And in order to deliver a quality smile, we use genuine materials, which adds to the cost, but we want to keep the treatment affordable, for which we have come up with, meticulously we come up with packages that are affordable at a very nominal monthly installment. So it will not be very heavy on the pockets as well.
And before we wind up, what do you have to say about Al Hilal Healthcare, and what are the services you offer at Manama branch?
Yes. So, miss, it's been an honor to be associated with Al Hilal Healthcare. It's the largest in the Kingdom of Bahrain and the fastest growing in the Middle East health sector. And as a dental unit, we work as a team in order to provide the best treatment practices for all our patients, and we want to make the treatments available, accessible and affordable for all.
Thank you, doctor.
Thank you so much.
Thank you for joining us and giving us a lot of valuable information about braces treatment.
Thank you so much for having me in the session, miss.
So viewers, I hope this was a very informative episode. If you have any dental issues, feel free to visit any Al Hilal branch in Bahrain. And stay happy, stay healthy, smile often, and till we meet again next time, this is Jessila Mujib signing off. Good night.
All your favorite products under one roof in Bahrain from our 14 branches at 27-year-old Megamart and Macromart. Bakery, fresh meat and fish, fruits and vegetables, sweets and snacks, ready-to-eat foods, dairy products, grocery or consumer goods. To have a wonderful shopping experience, please visit your nearest Megamart Macromart branch. Megamart and Macromart.